So welcome to this session on understanding the symptoms and diagnostic criteria for depression. Depression is a common comorbidity with chronic pain, especially among this population, Central American immigrants. Recognizing the signs and understanding the diagnostic framework is essential for providing effective care. So what is depression? Depression, clinically known as major depressive disorder, is more than just feeling sad or going through a rough patch. It is a serious mental health condition that affects how a person feels, thinks, and handles daily activities. The Diagnostic and Statistical Manual of Mental Disorders provides the standard criteria for diagnosing depression. So let's talk about the diagnostic criteria for depression as per the DSM-5. According to the DSM-5, a diagnosis of major depressive disorder requires the presence of 5 or more of the following symptoms during the same 2-week period. At least one of the symptoms must be either 1, depressed mood, or 2, loss of interest or pleasure, or anhedonia. Depressed mood. Most of the day, nearly every day, as indicated by either subjective report, for example, feel sad, empty, hopeless, or observation made by other people, family members, friends, partners, peers. So like, for example, the person appears tearful, flat-affected, or not engaging enough. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. Significant weight change or appetite disturbance is another symptom that could be a part of it. Significant weight loss when not dieting, or weight gain, or decrease or increase in appetite nearly every day. Also, insomnia or hypersomnia nearly every day. Psychomotor agitation or retardation nearly every day, or observable by others, not merely subjective feelings of restlessness or of being slowed down. There can also be fatigue or loss of energy. We see that a lot, loss of energy nearly every day, feelings of worthlessness or excessive guilt nearly every day, which may be delusional, diminished ability to think or concentrate, either by subjective account or as observed by others. Recurring thoughts of death or suicidal ideation, that's one of the worst symptoms, of course. And not just fear of dying, but recurring suicidal ideation without a specific plan or a suicide attempt or a specific plan for committing suicide. Understanding the symptoms. So depressed mood and anhedonia. These core symptoms involve a pervasive feeling of sadness and a marked reduction in interest or pleasure in almost all activities. Changes in appetite and sleep patterns. So depression often disrupts normal eating and sleeping habits, leading to significant weight changes and either insomnia or excessive sleep. There can also be psychomotor changes. Individuals may experience noticeable agitation or retardation in their movements and speech. The fatigue and loss of energy, persistent tiredness and lack of energy can severely impact daily functioning. The feelings of worthlessness and guilt, these thoughts can be overwhelming and are often disproportionate to the actual circumstances. Cognitive impairments, so basically difficulty concentrating, making decisions, and remembering details are common cognitive effects of depression. In the suicidal ideations, thoughts of death and suicide are serious symptoms that require immediate attention. The prevalence rates among Central American immigrants, according to the research, it indicates that depression is very prevalent among this population, often exacerbated by factors such as cultural dislocation, socioeconomic hardships, and limited access to mental health services. These populations may experience unique stressors related to their immigration status, separation from family, and challenges in adapting to a new cultural environment. It is crucial to approach diagnosis and treatment with cultural sensitivity and an understanding of these contextual factors. So what is the impact of comorbid chronic pain? So being depressed and having chronic pain at the same time. Chronic pain and depression frequently coexist, each exacerbating each other. Pain can lead to feelings of hopelessness and helplessness, contributing to depressive symptoms. Conversely, depression can magnify the perception of pain, creating a vicious cycle that is difficult to break. So definitely, effective treatment strategies often need to address both conditions simultaneously. So let me give you a recap. Understanding the symptoms and diagnostic criteria for depression is critical for providing comprehensive care to patients, especially those dealing with chronic pain and other comorbid conditions. Accurate diagnosis and timely intervention can significantly improve outcomes for individuals suffering from depression. Now, let's watch Dr. Snipes on major depressive disorders and related disorders as per DSM-5-TR, which is the latest version, as we all know. And so she gives a full explanation of this disorder.